Hi everyone, my name is Sahana Somasegar and I'm a current resident at the University of Chicago. I have had the opportunity to work with Dr. Ariel Weiss, Dr. Elizabeth Swisher, and Dr. Ernst Langell, as well as colleagues at the University of Washington and the University of Chicago. Today I will be presenting our research titled Germline Mutations in Black Patients with Ovarian, Fallopian Tube, and Primary Peritoneal Carcinomas. Routine genetic testing for ovarian cancer and identification of germline mutations can improve early detection of ovarian cancer and help guide treatment. Indications for referral to genetic testing for hereditary breast and ovarian cancer, according to the NCCN guidelines, do not vary by race. Similarly, the Society of Gynecologic Oncology released guidelines in 2014 recommending genetic counseling and testing for all patients with ovarian cancer regardless of race. Despite these recommendations, knowledge of genetic counseling and referral rates for genetic testing has been lower for Black patients compared to white patients. Hypothetically, lower germline BRCA mutation rates in Black individuals could explain some disparity in outcomes. However, as race is a social construct, we hypothesize that Black individuals with ovarian cancer have similar germline BRCA mutation rates. Disparities in outcomes are likely more appropriately attributed to social determinants of health and structural racism. In this study, we aim to better characterize and describe the demographics of Black individuals with carcinoma of the ovary, fallopian tube, or peritoneum, and characterize the presence of germline mutations. 51 Black patients with invasive epithelial ovarian, fallopian tube, or primary peritoneal carcinoma were identified via institutional tissue banks over a 20-year time period. Germline DNA was sequenced using a targeted capture and parallel sequencing assay that identified pathogenic germline mutations in 12 ovarian cancer susceptibility genes. 51 patients met inclusion criteria and self-identified as Black in our study. Of these 51 patients, 13 patients had germline mutations identified in one of the ovarian cancer susceptibility genes. As expected, BRCA1 and BRCA2 were the most commonly mutated genes in our population. Among patients with germline mutations, BRCA1 mutations were identified in 54% of patients, and BRCA2 mutations were identified in 31% of patients. The distribution and mutational profile among BRCA1 genes are shown in the lollipop plot here. The truncation variants, such as frame shift, are shown in orange, missense mutations in green, and others in purple. On the vertical axis, we show the frequency of appearance of each mutation. On the horizontal axis, we show the amino acid possession of each mutation. No two patients had the same specific mutation. Of the 13 patients who had pathogenic germline mutations, all of their cancers were high grade. 11 of the 13 had primary ovarian cancer, and the remaining 2 had a primary fallopian tube cancer. 11 patients had serous histology, 1 patient had a carcinoma, and 1 patient had a carcinosarcoma. All patients were advanced stage. Of note, among the entire study population, surgical outcomes were known for 46 of the patients. Of these 46 patients, optimal cytoreduction to less than 1 centimeter maximum residual tumor diameter, as was the definition during the early part of the study, was achieved in 82.6% of patients, or 38 of the 46 patients, without difference according to germline mutation status. Progression-free interval and overall survival within our study population was evaluated and stratified by the presence of a deleterious germline homologous recombination mutation in BRCA1, BRCA2, or RAD51D for those patients with stage 2 to 4 disease. Median progression-free interval was 906 days, or 29.7 months, among those with HR germline mutations compared to 403 days, or 13.2 months, among those without, with a hazard ratio of 0.44 and a 95% confidence interval of 0.23 to 0.85 with a p-value of 0.0074, as shown in Figure 1a. Median overall survival was 1824 days, or 60 months, among those with germline mutations compared to 943 days, or 31 months, among those without, again with a hazard ratio of 0.52, 95% confidence interval of 0.22 to 1.21, and a p-value of 0.22 as shown in Figure B. Of those patients with a germline HR mutation with a known platinum sensitivity status, 2 of 10 had platinum-resistant or refractory disease compared to 9 of 27 without mutations, with a p-value of 0.46. In conclusion, our data showed that there are not major differences in the genetic predisposition to ovarian carcinoma of Black and white individuals, which supports the existing recommendation to provide genetic testing to all patients with ovarian carcinoma regardless of race. With careful and equitable implementation, advances in genomic technology should be equally available to Black and white patients, improving access to precision medicine for all individuals with or without hereditary risk for ovarian cancer.